My name is Carina Wagner. I'm a licensed acupuncturist, and I work with a great team of practitioners over at the Institute for Health and Healing. We are located in downtown, close on Sonoma Avenue, close to downtown Santa Rosa. And just a little background, we are Sutter Health's integrative medical clinic, and there's four clinics like we have here, ranging from San Francisco all the way up to Sacramento. Today, I'm going to talk about understanding colds and flus through a Chinese medicine paradigm and give you a few offerings about how we might treat them. So every time I give a talk on some aspect of Chinese medicine, I always struggle a little bit with how much I need to define the terms in order for my audience to understand what I'm talking about. So my goal today is to keep it as simple as possible, but share enough so that we're all on the same page. A big concept to start with is qi. What is qi? So in Chinese medicine, qi is thought as the basic principle of life. It's thought of as innate intelligence in imbibing everything in the world. Qi also runs in the body, and in the body we often describe qi as life force energy. Qi performs many different functions depending on what part of the body it influences. So today I just want to talk about a specific kind of qi. It's called defensive qi, or in Chinese we call this wei qi. That's W-E-I, wei qi. So wei qi is our body's defense mechanism. It is taught that wei qi travels through the skin and the muscles and acts as a sort of a barrier to protect and defend our body against anything foreign that might attack us from the outside. In Western terms, we can understand wei qi as part of the immune system that functions to control the opening and the closing of our pores, and to some extent it regulates temperature. In Chinese medicine, we equate strong wei qi with good immunity. We strengthen our wei qi through following basic practices like eating well, getting good sleep, exercising, and managing our stress. However, likewise, if we don't take care of ourselves, our ability to create and maintain strong defensive qi also suffers, and we become more vulnerable to contracting health issues, in this case like colds and flus. In Western medicine, it is generally thought that only viruses themselves are the cause of viral infections. However, in Chinese medicine, viruses and even bacteria are thought to coexist in the body and don't necessarily pose a threat to our health unless our overall qi, and in particular our wei qi, is weak. In Western medicine, the goal of treatment is to target individual pathogens as a strategy to get rid of the infectious disease process. While in Chinese medicine, the emphasis is more on supporting and nourishing the organs and the meridian complexes to strengthen our natural defenses. Many people have a propensity to getting recurrent colds and flus throughout the year. I'd like to share with you just a very important herbal formula that's been around for about 800 years, and it addresses this concern. Get ready for a mouthful. It's called Yu Ping Fang Song, or in English, we call this Jade Wind Screen Powder. If you're interested in learning more about it, if you just Google the English name, Jade Wind Screen Powder, it will come up. So this formula is designed to tonify qi and support the body's immunity. It's composed of just 3 herbs. That's pretty unusual in Chinese medicine to have just 3 herbs, but in this case they just are perfectly matched. Astragalus Root is the chief ingredient of the formula, and maybe many of you have heard of Astragalus Root. It's categorized as a qi tonic and is known for boosting energy in the body as well as specifically strengthening the lungs. It has been used traditionally to boost immunity in patients who present with symptoms of classic weak qi. These are the basic symptoms of spontaneous sweating, that's like sweating without activity, fatigue and malaise, recurrent colds and flu, and chronic seasonal allergies. Researchers have studied this formula extensively, and it's been shown in study after study to have a wide application in treating a whole variety of immune system disorders. So when taken throughout in advance and throughout the cold season, it can be a great help in reducing or eliminating colds and flu symptoms. I can attest to using this personally with patients and successfully to get them through the winter without succumbing to their usual respiratory problems. So the next thing I want to talk about is how Chinese medicine understands the origins of cold and flu. Many diseases in Chinese medicine are thought to be caused by externally driven forces in our environment. They are referred to as the 6 external pathogenic influences and are categorized as wind and cold and heat, dryness, dampness, and summer heat. They essentially are climates. So the Chinese were very astute at observing nature, and they noticed that in the fall of any given year, with winter approaching, the wind picked up in the provinces and people began to get sick. So it was just totally natural for them to believe that wind brought these pathological influences. It is said that wind enters the body through the back of the neck and the head. And interestingly, there's a common acupuncture point that most acupuncturists use called wind gate. We use it to treat headaches and stiff and aching muscles in the neck, shoulders, and upper back. In other words, it gets rid of wind. Wind always combines with either cold or heat to form 2 well-known patterns called wind, cold, and wind heat. Let's start with wind cold. So most of the symptoms of wind cold appear at the onset of a cold and flu when the pathogenic influences are just beginning to take hold. In a classic wind cold pattern, the first thing that someone notices is that they feel really cold. It's the kind of cold that you want to cover yourself up in a blanket, even if it's a super hot day. Other symptoms may include deep body aches, tight neck and upper back muscles, runny nose, headache, and just a general feeling of malaise. So if the best remedy at this stage is to rest, stay warm, and drink plenty of warm fluids. We've all heard this. We also recommend sipping on hot ginger tea sweetened with honey while wrapping yourself in a warm blanket to create a sweat that will purge the wind cold pathogen. Eating miso soup or homemade chicken soup are also great because they're warming and nourishing and easy to digest. So if you were able to identify these symptoms and act quickly, chances are you can beat the wind cold pathogen and just knock it out just with these few measures. But if you're like most of us and we just kind of like push these things into the background and continue on, the wind cold stage can move on to the next pattern. It's called wind heat. At this stage, the pathogen has moved deeper into the body, and now there are more signs of heat. There might be fever, sore throat, cough with yellow phlegm. There's more likely more thirst than usual and a general feeling of irritability. As with wind cold, one should stop all activity, get into bed, get lots of rest, and hydrate with warm fluids. However, at this stage, the focus on drinking is drinking teas from the mint family or herbs that have a cooling effect rather than ginger, because we want to decrease the heat inside. And eating less in general can be good for the body because it gives us a chance to fight the pathogen rather than expending energy having to digest a meal. And specific foods to avoid are dairy foods and wheat products, as these are well known to promote mucus in the body. Chinese medicine offers many options for herbal support at each stage of the cold or flu. There are dozens of well-studied formulas, and all Chinese medicine practitioners have their favorites. So for the beginning of a cold or flu pattern, I like to recommend starting with a formula called Gan Mao Ling, Ganmao Ling, Ling. It's really, you can Google it, it's out there. So this can be used for both early stages, wind cold or wind heat. And it's considered one of the most effective formulas, especially if started within the first 24 hours. It contains powerful antibacterial and antiviral herbs, along with this category of herbs called wind-relieving herbs that are intended to lift the pathogen out of the body. So if your cold and flu symptoms just aren't getting better or they're getting worse, this would be a good point to make an appointment with an acupuncturist to help fine-tune your treatment plan. Acupuncture can also be really helpful and is effective in supporting your qi and removing any blocks along the meridian pathway. So what else is in our Chinese medicine tool bag? This is one many people are familiar with. It's called Gua Sha. It actually translates to scraping technique, and it's an effective folk medicine practice that has been used all over the world to help the body expel toxins through the skin. It's especially useful in the early stages of a cold or flu when the pathogenic influences are still residing at the skin level and haven't penetrated deeper into the body. A typical and commonly used Gua Sha tool is the rounded edge of a plastic Chinese spoon. However, anything that has a smooth rounded edge will work well. When I do Gua Sha with a patient, I start by applying a small amount of oil to the skin at the back of the neck and upper back, and so that the Gua Sha tool will glide easily along the skin. And I do it until the skin takes on a pink or reddish color. If there's a lot of heat and congestion in the muscle layer, the skin will turn purplish and blotchy looking. While this may look like a bruise, it really is not. The red marks that form from Gua Sha represent stagnant blood and metabolic waste in the superficial tissues of the body. The discoloration may last up to a week or so, but the relief is felt almost immediately. Gua Sha is a fantastic tool for relaxing tight, stiff, achy muscles that come along with colds and flu. And more recently, lots of people have discovered the use of essential oils in diffusers. Diffusing with essential oils can help decrease the bacterial and viral load in the air in any space. And specifically, I'm thinking in your home, because lots of times we can't use them in the office. The list of effective antimicrobial oils for fighting colds and flus are long, but some of my favorites are lavender, peppermint, lemongrass, eucalyptus, and rosemary. And you can buy an inexpensive and good quality diffuser online for about $20 to $40. So about the oils, just make sure they're high-grade essential oils that you use in the diffuser. With regard to purity, if the oil is organic, that is a good sign. But not all good oils are organic, because some of them are I forget the term now, are just harvested from places where there's no organic ordinances. But that's just something to look for. Also, but this is important, avoid oils that list the word fragrance on the label, as this would indicate that the oil is synthetic. So personally, I run the diffuser most days, and I love coming in at the end of a work day to a clean and wonderful smelling house. So before closing, I want to add one more thing, just to acknowledge that we are all living in the age of COVID-19. And this is new ground for all of us. And when you have symptoms of a cold or a flu in this environment, you might not be able to distinguish it from a COVID-19 infection. So with this in mind, I strongly encourage you to work in collaboration with your Western allopathic providers. And if you have any question about this being COVID-19, make sure you get tested right away. Chinese herbs really do have a lot to offer for the treatment of colds and flus. American herbs do too. You might, say the equivalent would be echinacea and golden seal. But as you go further into the heat pattern, Chinese herbs have very specific offerings that I think Western herbs don't. That's just my opinion. Then I think I'll sign off and wish you all a great day. And I hope that this has been helpful. Okay. Bye for now.